Hello guys, good evening everyone. I welcome you all on Unacademy, India's largest learning platform. We are here at the channel Let's Crack NEET PG. Good evening everyone. Myself Dr. Nidhi. I am alumni of King George Medical University KGMU Lucknow. I am teaching you all physiology, and guys, we all know physiology weightage is so much high. Every year 15 to 20 question for sure come in our exam. So everyone clear the concept of physiology so that you can score more in your exam and you will be able to achieve your target. Everyone download this Unacademy learning app and follow me out there. My page is unacademy.com at this /KGMC. This is my page. You can follow me out there so that you can attend many more classes out there also. There is ongoing course on the physiology. You can join that by using my referral code, that is Dr. Nidhi. I had taken many special classes. You can access anytime all these classes. There are many other renowned educators on this platform. So if you join the plus, you will be definitely benefited by this subscription. Now coming to the benefit of subscription. There are two types of subscription, plus and iconic. In plus, you will get the benefit of live classes. In live classes, you can interact with your educator and you can clear your doubt in live classes only. There are various live tests and quizzes out there by which you can analyze your preparation anytime. There is a batch course, capsule course ongoing there, so you can join anytime. There is a structured schedule out there. You can definitely able to achieve your target if you follow that structured schedule. Now coming to the iconic subscription. This is newly launched by Unacademy. In this you will be benefited with the prep ladder videos also. You can access the video lecture of prep ladder. You can access the question bank. You can access the rapid revision course, and you will also be provided with handwritten notes. So if you want to access this also, you can go for the iconic subscription. Now coming to the subscription fee. Iconic subscription starts from 1 year. 1 year fee is 55,000. 18-month fee is 66,000. 24-month fee is 77,000. 36-month fee is 92,000. After using my referral code, you will get instant 10% discount in your subscription, and your subscription fee will become more economical for all of you. So 1 year fee will become 49,500. 18-month fee will become 59,400. 24-month fee will become 69,300. And 36-month fee will reduce and it will come to 82,800. So do use my referral code to get instant 10% discount in your subscription. Now coming to the plus subscription. Plus subscription are also available for 1 month, 3 months, 6 months. So according to your requirement, you can take the subscription. If you are giving examination this year only, you can go for 1 month or 3 months. If you are planning to give the exam next year, go for the 12-month package. This will become more economical when you are comparing per month fee. The 12-month fee is only 2,292. So that will be more economical for you, and there you will get enough duration to revise your topic. Okay? And finally a student can go for 2 year, 3 years. Okay? Chalo. Now using my referral code, you will get instant 10% discount, and 1 month fee will become 4,500. 3 month fee will become 11,250. 6 month fee will become 20,250. 12 month fee will become 24,750. Or 18 month fee will become 29,250. 24 month fee will become 36,000, and 36 month fee will become 45,000. So do use my referral code, everyone. Everyone download this Telegram app and follow me out there so that you will get notification of every class and you won't miss single class. My page is NEET Physiology, or you can search Unacademy Physiology. Follow me out there. Now coming to our topic, we will today study about the nerve physiology. First we will study about the nerve action potentials. First coming to the cells present in our nervous system. There are two type of cell, neurons and glial cell. Neurons are various type, unipolar, bipolar and multipolar, pseudo-unipolar. These are various type of neuron. Now coming to the glial cell. Glial cell are basically two type, macroglial cells and microglial cells. Macroglial cells are of three type, astrocytes, oligodendrocytes and Schwann cell. Microglial cells are our phagocytic cells. Okay? Do remember this point? Cells present in CNS are neurons and glial cell. There are two types of glial cell, macroglial cell and microglial cell. Macroglial cell consists of astrocyte, oligodendrocytes, Schwann cells. Microglial cells consist of phagocytic cells. Clear everybody? Chalo. Now coming to first microglial cells. First is astrocyte. They are star-shaped cells. There are two types of astrocytes. Fibrous astrocyte, which is present in white matter. There is protoplasmic astrocyte, which is present in gray matter. This is our protoplasmic astrocyte and this is our fibrous astrocyte. This protoplasmic astrocyte is present in everyone gray matter. Fibrous astrocyte कहाँ present होता है? It is present in white matter. ठीक है? Now coming to the function of astrocyte. It help in formation of blood-brain barrier. It help in uptake of potassium and neurotransmitter to the nerve cells. It is nutritive in function to the neuron. So do remember this point. The function of astrocyte is formation of blood-brain barrier, uptake of potassium and neurotransmitter, nutritive function to the neurons. Clear everybody? Chal. Now coming to the next cell, that is oligodendrocyte. This oligodendrocyte and Schwann cell are responsible for myelination. ठीक है? And this oligodendrocyte are responsible for CNS myelination and Schwann cell are responsible for PNS myelination. ठीक है? This oligodendrocyte causes multiple myelination. What does it mean? That one oligodendrocyte form myelin sheath around multiple neurons. Around 1:30 का ratio होता है. One oligodendrocyte undergo myelination for 30 neurons. ठीक है? काफी important है, सभी लोग याद रखिएगा. This oligodendrocyte is responsible for CNS myelination and it cause multiple myelination. Clear everybody? Schwann cell are responsible for myelination in peripheral nervous system and it cause myelination around only one nerve fiber. So the myelination ratio is 1:1. Clear? This is the difference. Do remember this point everyone. This is our oligodendrocytes. This is myelinating this neuron also, this neuron also. So this is present in our central nervous system. This is our Schwann cell. This cause myelination around single neuron. So this is present in our peripheral nervous system. Clear everybody? Chalo. Now coming to the various types of neuron. First we studied the unipolar one. This unipolar is present in our invertebrates. Next is pseudo-unipolar. This is important to remember this point. This pseudo-unipolar neuron is present in our dorsal root of ganglia. काफी बार क्वेश्चन आया ऐसे, so do remember this point. Pseudo-unipolar neuron are present in dorsal root ganglia. Bipolar neuron, they are present in our retina. They are present in our olfactory epithelium. They are present in the sensory ganglion of cochlear and vestibular nerve. ठीक है? Next is multipolar neuron. Our spinal motor neurons are multipolar. ठीक है? Everyone remember this point कि कौन सा neuron कहाँ present है. Unipolar is present in invertebrate. Pseudo-unipolar is present in dorsal root ganglion. Bipolar is present in our retina, olfactory epithelium, sensory ganglia of cochlear and vestibular nerve, and multipolar are present in spinal motor neuron. ठीक है? This is the diagram. हमारे cell body से एक structure arise कर रहा है, so this is unipolar. From cell body to structure arising, so it is bipolar. दिस इज स्यूडो यूनिपोलर. दिस इज द सेल बॉडी. इससे क्या अराइज कर रहा है? सिंगल स्ट्रक्चर अराइज कर रहा है, दैट फर्दर डिवाइड इनटू 2 और मोर. ठीक है, दिस टाइप ऑफ न्यूरॉन इज स्यूडो यूनिपोलर. व्हाट इज मल्टीपोलर? फ्रॉम सेल बॉडी various structure are arising, so this is multipolar. Clear everybody? Chalo, now coming to the parts of a neuron. Let me draw a diagram for all of you. These are dendrites arising from our cell body. ठीक है, this is cell body. This is the nucleus of cell body. These small things are Nessel's granule. And these structures are dendrites. This is nucleus of our neuron. This structure is our axon part of neuron. ठीक है. First, perikaryon. What is perikaryon? Our cell body is also known as perikaryon. It is also known as soma. It consists of nucleus. It consists of Nessel's body. This Nessel body is important. Do remember this point. What is Nessel's body? They are the rough endoplasmic reticulum of our neuron. Beside rough endoplasmic reticulum, our neuron also consists of Golgi bodies. So these will be present in our cell body or soma. Next is dendrites. What is dendrites? These are dendrites. They are the receiving end, or you can say they are the receptor zone. ठीक है. Next part is axon hillock. Axon hillock is part of cell body. Confuse नहीं होना है, नाम में है axon hillock, but it is not part of axon. It is part of cell body or cyton, जहाँ से axon originate होता है. From where axon originates. ठीक है. Next is our initial segment. This initial segment is unmyelinated portion of axon. ठीक है. Do remember this point? Initial segment is a part of axon. ठीक है. Axon hillock is a part of cyton. This initial segment has lowest threshold. ठीक है. That's why action potential generates out here. ठीक है. Next part is axon telodendria. This is also known as synaptic knobs or terminal buttons. देखो, this is the diagram. This is our axon telodendria. Telodendria, which is also known as synaptic knob or terminal button. Clear everybody? This is the parts of our neuron. Now coming to the axon conduction speed. Axon conduction speed is directly proportional to the myelin. If myelin is present, then the conduction will be fast. If myelin will be absent, conduction कैसा होगा? Slow. ठीक है. चलो. This is the structure. This is our soma or cell body. This is nucleus of our neuron. This is nucleolus, the center part. These are dendrites which are receiving end. This is axon. This part is axon. ठीक है. यहाँ पे दो पॉइंट है, axon hillock and initial segment. They both are the trigger zone. इसका जो threshold होता है that is lowest. That's why action potential generates out here? ठीक है? Do remember this point, axon hillock and initial segment. This axon hillock is part of cyton. This initial segment is part of axon. Clear everybody? These are internodal areas. This is myelin sheath which is formed by our Schwann cells. Area where myelin sheath is absent is node of Ranvier. And this terminal part is known as synaptic knobs or terminal buttons. ठीक है? Clear is structure? चलो. Now coming to the node of Ranvier. The area of axon जहाँ पे myelin sheath is absent, this is known as node of Ranvier. And this node of Ranvier region has maximum number of sodium channels. ठीक है? That's why threshold of this node of Ranvier is also low. Clear everybody? So the site of action potential in motor neuron is initial segment, while in sensory neuron it is first node of Ranvier. ठीक है? Do remember this point everyone. Site of action potential in motor neuron is initial segment, and in sensory neuron it is first node of Ranvier. Clear? चलो. Now coming to the exoplasmic transport. Two type of transport is out here. First is anterograde transport. What is anterograde transport? Transport from our cyton to axon is known as anterograde transport. ठीक है? And transportation from axon to cell body is known as retrograde transport. So in our axon, both transport occur, anterograde and retrograde. What happened? Neurotransmitters are formed in our cyton. These are released at our synapse. So this neurotransmitter is transported in the axon via anterograde transport. ठीक है? और release हो जाएगा हमारा neurotransmitter, and that empty vesicles will again move to our cell body via retrograde transport. ठीक है? That's why in our axon both anterograde and retrograde transportation occurs. Clear? चल. Now coming to the action potential in neuron. This action potential in neuron can be measured or recorded by cathode ray oscilloscope. ठीक है? Now coming to the terms, that is latent period. What is latent period? Time gap between the stimulus and response is known as latent period. Next is stimulus. The stimulus to produce a response should have intensity of a stimulus should be rapidly rising and the duration should be of optimal enough. ठीक है? There are two criteria जो कि stimulus अगर होगा तो हमारा एक्शन पोटेंशियल जनरेट होगा. ठीक है? क्या? फर्स्ट इज इंटेंसिटी ऑफ स्टिमुलस शुड बी रैपिडली राइजिंग. नेक्स्ट इज ड्यूरेशन शुड बी ऑप्टिमल इनफ. These two criteria अगर fulfill होगा, action potential will be generated. Next is what is threshold stimulus? The stimulus after which our neuron will be responding. That stimulus is known as threshold stimulus. Clear? चलो. Now coming to the strength duration curve. जब neuron only respond through threshold stimulus. इससे बिलो अगर स्टिमुलस की इंटेंसिटी होगी तो हमारा न्यूरॉन रिस्पॉन्ड नहीं करेगा. देयर आर टू टर्म्स आउट हियर, रियोबेस एंड क्रोनैक्सी. व्हाट इज रियोबेस? Riobase is the minimum strength of a stimulus required to produce a response. This stimulus is known as riobase and its normal value is 1 milliampere. ठीक है? Next is chronaxy. What is chronaxy? When the strength of a stimulus is double the riobase, time taken by a tissue to show response is known as chronaxy. ठीक है? Clear? Riobase क्या है? Minimum strength of a stimulus required to produce response is riobase. What is chronaxy? Time taken by a tissue to reproduce response when stimulus is twice Rho base. ठीक है? So do remember this point, chronaxy and Rho base. चलो, हमारा जो excitability है that is inversely proportional to chronaxy. और chronaxy का increasing order देखें तो first सबसे कम होता है हमारा myelinated fiber का, then come our unmyelinated nerve fibers, then come our skeletal muscle, then come our cardiac muscle, then come our smooth muscle. So the excitability of myelinated nerve will be most, then come our unmyelinated, then the skeletal, then cardiac, then smooth. ठीक है? So do remember this sequence. अब आते हैं दो important terminology पे, accommodation and adaptation. ठीक है? When repeated stimulus of sub-threshold intensity is given, no action potential will be produced, and this is due to the accommodation. ठीक है? When repeated stimulus of sub-threshold intensity is given, no action potential is generated, and it is due to accommodation. ठीक है? What is adaptation? When repeated stimulus of supra-threshold intensity is given, then also there is no action potential generation, and this is due to adaptation. ठीक है? Clear everybody? Supra-threshold होगा, action potential generate नहीं होगा, and this is due to adaptation. Sub-threshold stimulus होगा तो भी हमारा action potential generate नहीं होगा, and this is due to accommodation. ठीक है? काफी इंपॉर्टेंट पॉइंट्स हैं, सभी लोग याद रखिएगा. चलो, अब आते हैं डिफरेंट फेजेस ऑफ एक्शन पोटेंशियल. ठीक है? फर्स्ट फेज, second phase is depolarization, third phase is repolarization, and fourth phase is hyperpolarization. अब बात करते हैं डिफरेंट फेजेस की. तो फर्स्ट फेज इज लोकल पोटेंशियल चेंज, एंड इसमें क्या होता है, हमारा जो रेस्टिंग मेम्ब्रेन पोटेंशियल है दैट changes from -70 millivolt to -55 millivolt, and this -55 millivolt is also known as threshold potential or firing level. ठीक है? And this local potential change is due to influx of sodium, and this influx of sodium is slow influx of sodium. Clear? Next phase, that is phase 2, it is depolarization phase, and it is due to influx of sodium. ठीक है? और ये ओवरशूट करता है यहाँ पे पोटेंशियल 2 + 35 millivolt. Clear? First phase is local potential change. Second phase is depolarization phase. Both phases are due to sodium influx. Clear? Next phase, that is repolarization phase. And this repolarization phase is due to potassium efflux. Clear? और यहाँ पे जो potential है that comes again to -70 millivolt. ठीक है? Local potential change में potential हमारा -70 millivolt से -55 millivolt पे रीच करता है. Depolarization में this -55 millivolt overshoots to +35 millivolt, and in repolarization what happened, it again reaches to -70 millivolt, and this repolarization is due to potassium efflux. Last phase, most important phase, that is hyperpolarization. ठीक है? What is hyperpolarization? It is the potential become more negative. From -70 millivolt, the potential goes to -90 millivolt. This phase is our hyperpolarization. और ये क्यों होता है? जो सोडियम जो पोटेशियम चैनल से efflux हो रहा है, that return slowly to the closed state. So there will be continuous potassium efflux, and this potassium efflux will cause hyperpolarization. And when the neuron is hyperpolarization, there is inhibition of neuronal function. ठीक है? Clear everybody? These all are phases of our neuron action potential. Clear है? Proceed करें. चलो डायग्राम देखो. This is phase 1, this is phase 2, this is phase 3, this is phase 4. Phase 1 is local potential change, and it is due to sodium efflux. ठीक है, सोडियम इनफ्लक्स होगा, पोटेंशियल विल राइज फ्रॉम -70 millivolt to -55 millivolt, and this -55 millivolt is firing level. ठीक है, जैसे ही -55 millivolt रीच होगा, एक्शन पोटेंशियल विल बी जनरेटेड. आवर नेक्स्ट फेज डीपोलराइजेशन विल स्टार्ट, and this is due to also sodium influx. And in this phase what happened? Potential overshoots to 30 to 35 millivolt. After that our next phase start, that is repolarization. It is due to potassium efflux. ठीक है, last phase that is hyperpolarization, and it is due to the slow return of potassium to the closed stage. ठीक है, पोटेशियम इफ्लक्स कंटिन्यू होगा एंड दैट विल लीड टू हाइपरपोलराइजेशन. एंड यहाँ पे जो पोटेंशियल चेंज होता है फ्रॉम -70 millivolt to -90 millivolt, एंड दिस हाइपरपोलराइजेशन इज रिस्पॉन्सिबल फॉर इनहिबिशन ऑफ न्यूरोनल फंक्शन. क्लियर एवरीवन? क्लियर? चलो, एंड आवर जो गाबा है, इनहिबिटरी न्यूरोट्रांसमीटर है, वो भी हाइपरपोलराइजेशन स्टेट को ही प्रोलॉन्ग करता है. दिस गाबा विच इज इनहिबिटरी न्यूरोट्रांसमीटर, व्हाट इट कॉजेस chloride influx and potassium efflux, and this will cause hyperpolarization. ठीक है, एंड हमारा न्यूरोनल फंक्शन इनहिबिट हो जाएगा. ठीक है, दिस इज हाउ आवर इनहिबिटरी न्यूरोट्रांसमीटर वर्क्स. क्लियर? दैट्स व्हाई जो भी हम गाबा एगोनिस्ट देते हैं, बार्बिचुरेट एंड बेंजोडाइजेपिन, so what will it do? It will inhibit the neuronal function and that will cause sedation. Clear everyone? Clear? Chalo, now coming to the refractory periods. Two refractory periods are there: absolute refractory periods and relative refractory period. What is absolute refractory period? ये वो period है जब there will be no second action potential in spite of stimulus of any strength, any duration. ठीक है, cell will not able to fire the second action potential from any stimulus of any strength and any duration. किसी भी strength का stimulus हो, किसी भी duration के लिए हो, there will be no action potential. ठीक है, there will be no second action potential. This period is known as absolute refractory period. ठीक है, next is relative refractory period. Relative refractory period कहाँ से start होता है? That starts from 1/3 of repolarization to the end of action potential. Good evening, Dr. Shashank. 1/3 of repolarization से till the end of action potential, the period is relative refractory period. इसमें क्या होगा? Cell is able to fire the second action potential when the stimulus is given of maximum strength. ठीक है, relative है, means कि अगर stimulus का strength low होगा तो second action potential generate नहीं होगा, और stimulus maximum strength का use करेंगे तो there will be generation of second action potential. और ये relative refractory period कहाँ से start होता है? From 1/3 of repolarization to the end of action potential. Clear? And this is the summary. Longer the refractory period, the frequency of stimulation will be lower. ठीक है? Clear everyone? चलो. This is the diagram showing absolute refractory period and relative refractory period. In absolute refractory period, there will be no generation of second action potential. ठीक है, और रिलेटिव रिफ्रैक्टिव पीरियड कहाँ से स्टार्ट होता है? 1/3 ऑफ रीपोलराइजेशन. थोड़ा सा डायग्राम में करेक्शन कर लीजिए, यहाँ से स्टार्ट होता है 1/3 ऑफ रीपोलराइजेशन टू द एंड ऑफ एक्शन पोटेंशियल. ठीक है, ये पीरियड होगा रिलेटिव रिफ्रैक्टिव पीरियड. इसमें अगर स्टिमुलस की स्ट्रेंथ अगर मैक्सिमम होगी, सो देयर विल बी सेकेंड एक्शन पोटेंशियल जनरेशन. क्लियर एवरीवन? चलो, नाउ कमिंग टू द गेट कंसेप्ट. ठीक है, ये गेट कंसेप्ट वोल्टेज गेटेड सोडियम चैनल्स के लिए एप्लीकेबल है. And this voltage gated sodium channels have 2 gate and 3 possible states. What are they gate? M gate and H gate. M gate is activation gate, H gate is inactivation gate. So inactivation state में क्या होगा? This H gate close होगा. Activation state में this M gate open हो सकता है या close हो सकता है. इसी पे depend करता है हमारा sodium influx. चलो, now coming to the 3 state. First is resting state or closed state. इस state में क्या होता है? M gate is closed. This M gate is closed and H gate क्या होगा? Open होगा. Clear? Next state क्या कौन सा होगा? Activation state, which is also known as open state. In this state there will be both H and M gate are open. और ये stage में क्या होता है? हमारा depolarization occur. हमारा सोडियम इनफ्लक्स होगा एंड दिस सोडियम इनफ्लक्स विल लीड टू depolarization. Clear? Next state is inactivation state. In inactivation state, M gate तो open है, but this H gate is closed, and this occurs during repolarization of neuron or muscles. Clear? So do remember this gate concept. Our sodium channel consists of M gate, which is known as activation gate, and H gate, which is known as inactivation state. ठीक है, resting state में क्या होगा? This M gate is closed and H gate is open. Activation state में क्या होगा? This both M and H gate are open. Inactivation state में क्या होगा? M gate is open while H gate is closed. ठीक है, everyone clear? Shall we proceed? चलो, जो लोकल एनेस्थीसिया है उसकी जो एफिनिटी होती है वो हाई एफिनिटी फॉर इनएक्टिवेशन स्टेट, सो दैट विल प्रोलॉन्ग द इनएक्टिवेशन स्टेट. ठीक है, clear? So LA will bind and prolong the inactive state because it has high affinity to the inactivation gate. Clear? Chalo. Now coming to the next topic, that is classification of nerve fiber. Most important classification, Erlanger-Gasser classification. This is a classification for both sensory fiber and mixed nerve fiber. And good evening, Dr. Abhishek, and this is on the basis of presence and absence of myelin. ठीक है, इसमें 3 types के classification में divide किया गया, A, B and C. A fiber are further divided into A alpha, A beta, A gamma, A delta. This A fiber and B fiber are myelinated, while the C fiber are non-myelinated. ठीक है, अब बात करते हैं माइलिनेशन की. तो फ्रॉम A to C माइलिनेशन इज डिक्रीजिंग, डायमीटर इज ऑल्सो डिक्रीजिंग. सो डायमीटर इज डिक्रीजिंग, दैट्स वाई नर्व कंडक्शन वेलोसिटी ऑल्सो डिक्रीजेस फ्रॉम A to C. ठीक है, क्लियर? A फाइबर में सबसे ज़्यादा माइलिन होता है, सबसे ज़्यादा डायमीटर होती है उसकी, एंड नर्व कंडक्शन वेलोसिटी इज ऑल्सो हाइएस्ट इन A अल्फा फाइबर्स. क्लियर एवरीवन? Now coming to the different nerve fiber. First we will go to study A alpha fibers. They are the thickest fiber, they have the maximum myelin, they have the fastest conduction velocity, and its velocity is about 120 meter per second. Okay? And most important point, that is A alpha fiber are responsible for proprioception, for joint position sensing, that's why sensory function. ठीक है, ये मिक्स फाइबर है, मोटर फंक्शन भी इसका होता है. दैट इज आवर ए अल्फा मोटर न्यूरॉन दैट इज गोइंग टू मसल स्पिंडल्स. ठीक है, क्लियर एवरीवन? मोटर फंक्शन A alpha motor neurons going to the muscle spindle. Sensory function our proprioception. Clear? Next fiber is A beta fiber. This fiber is purely sensory and they are responsible. Ma'am, how thyroid gland is related to myelination? How come thyroid gland for myelination? A beta fiber, this is purely sensory and they convey touch and pressure sensation. ठीक है, do remember this point. A beta fiber are responsible for touch and pressure. Clear everyone? चलो, now coming to the next fiber, A gamma fiber. A gamma fiber are purely motor. ठीक है, gamma motor neurons to the muscle spindles. ठीक है, this fiber is purely motor. Do remember this point? And they regulate the muscle tone and certain muscular reflexes. ठीक है, next fiber is A delta fiber. Very important. A delta fiber are responsible for fast pain. It is responsible for first pain. It is responsible for sharp pain. ठीक है, and they are also carrying the temperature sensation. ठीक है, काफ़ी important है, सभी लोग याद रखिएगा. फास्ट पेन हो, फर्स्ट पेन हो या शार्प पेन हो, आंसर विल बी A delta fibers. ठीक है, now coming to the next fiber, that is B fiber. B fiber is also myelinated and they are present in our preganglionic autonomic nerve fibers. ठीक है, clear? चलो, next fiber, last fiber, that is C fiber. They are the slow fibers and they are non-myelinated. ठीक है, and they are responsible for slow pain or second pain. ठीक है, and they are present in postganglionic autonomic nerve fibers. Preganglionic autonomic nerve fibers are B fiber and postganglionic autonomic nerve fiber are C fiber. First pain is carried by A delta fiber, second pain is carried by C fiber. ठीक है, clear? अब most important part, that is conduction velocity. For myelinated nerve fiber, conduction velocity is proportional to the 6 times of diameters. ठीक है, for unmyelinated nerve fiber, the conduction velocity is directly proportional to the diameter. ठीक है, clear? Let's see, take an example. Diameter of a nerve is 4. So conduction velocity in myelinated nerve fiber will become 6 times 6 into 4, that is 24. ठीक है, 24 times हो जाएगा. Myelinated nerve fiber होगा तो conduction velocity will be 24 times. ठीक है, unmyelinated fiber होगा तो that will be proportional to the under root of 4. So that will be 2. Clear? That's why myelinated nerve fiber में जो conduction velocity होती है, that is very much high. Clear? So remember this point, conduction velocity for myelinated nerve fiber is proportional to the 6 times the diameter. For unmyelinated nerve fiber, it is directly proportional to the under root of diameter. Clear? चलो, अब आते हैं most important part, that is different nerve fiber में First, coming to the spike duration. Spike duration is more for the C fiber, then come B fiber, then come A fiber. प्रेशर इंजरी की बात करें तो सबसे ज़्यादा डायमीटर होती है A फाइबर की, सो दैट इज़ मोर ससेप्टेबल टू द प्रेशर इंजरी. सो A fiber, then B fiber, then C fiber. Next is hypoxia susceptibility, where B fiber is more hypoxia susceptible. Then comes our A fiber, then come our C fiber. Last one, that is local anesthesia susceptibility. A fiber is most local anesthetic susceptibility. ठीक है? So do remember this point everyone. काफ़ी बार repeat हुआ क्वेश्चन इसी से. प्रेशर इंजरी के लिए सबसे ज़्यादा A fiber is susceptible, हाइपोक्सिया के लिए B fiber is susceptible, local anesthesia के लिए A fiber is most susceptible. Now coming to the next classification, that is Lloyd-Hunt classification. It is a numerical classification and this is only for the sensory fiber. और Langer-Gasser classification sensory fiber के लिए भी था, mixed fiber के लिए भी था. And this Lloyd-Hunt classification is only for the sensory fibers. ठीक है, this is the numerical classification. इसमें आता है type 1. Good evening, Dr. Vanshika. Type 1 is our same A alpha fibers. A alpha fiber was responsible for proprioception. So type 1 fiber are carrying the sensation of proprioception. That is joint position senses. Type 2 fiber are A beta fiber. They were carrying touch sensation. So type 2 is carrying the touch sensation. Next fiber is type 3, which is A delta fiber. ठीक है, and A delta fiber, remember, they were carrying the first pain or sharp pain. So type 3 will carry the first pain. Next fiber is type 4 fiber. These is nothing, these are our type C fiber. Type C fiber, remember, they were carrying the second pain. ठीक है, so type 4 are responsible for the second pain. ठीक है, everyone remember this point. Type 1, type 2, type 3, type 4. ठीक है, clear everyone? काफी बार क्वेश्चन आया है. फर्स्ट पेन is carried by A delta fiber or you can say type 3 fiber. Second pain or slow pain is carried by C fiber or you can say type 4 fiber. ठीक है, सभी लोग याद रखिएगा. This is important. Clear? चलो, अब आते हैं next topic, that is nerve injury. The most common cause of nerve injury is bone fracture. ठीक है, and most common part to be injured in neuron is our axon. ठीक है, whenever there is nerve injury, there will be degenerative changes and further there will be regeneration of that neuron. ठीक है, अब start करते हैं first degenerative changes. First we will study within 24 hours of injury what happened. There will be earliest changes and this include distal degeneration, which is also known as Valerian degeneration. ठीक है, and this includes myelin degeneration, and due to degeneration what will happen? Debris will be accumulated and to phagocyte that debris there will be infiltration of microglial cells. ठीक है, distal degeneration क्या हुआ? This is our neuron. Suppose this is a point of injury. So this area is known as distal part and this is known as proximal part. So within 24 hours what will happen? There will be distal degeneration, which is known as Valerian degeneration. There will be myelin sheath degeneration. ठीक है, and due to the degeneration there will be debris and that will be phagocyted by our microglial cells. ठीक है, next change is after 36 hours of injury. After 36 hours of injury what will happen? Nucleus in the cyton will be pushed towards periphery and proximal segment will start degenerating, and this proximal segment degeneration is also known as retrograde degeneration. ठीक है, Valerian degeneration is distal degeneration and retrograde degeneration is our proximal segment degeneration. Clear? There will be nucleus pushed toward periphery and there will be chromatolysis. What is chromatolysis? Nestle's body are destroyed. This occurs after 36 hours of injury. Clear, everyone? Within 24 hours of degeneration, Valerian degeneration. After 36 hours, retrograde degeneration will start. Clear? Chalo, this is the diagram. This is point of injury. So, this degeneration is distal degeneration, or you can say orthograde degeneration or Valerian degeneration. And this segment degeneration is known as retrograde degeneration or proximal degeneration. Nucleus will be pushed toward periphery and Nestle's granules out here will be degenerated, and this is known as chromatolysis. Clear है सभी को? क्या क्या changes होंगे? Within 24 hours क्या changes होंगे? After 36 hours क्या change होंगे? Shall we proceed? Chalo. This is again the diagram showing our degenerative changes. Myelin debris will be there due to our Valerian degeneration. So due to the debris, there will be infiltration of microglial cells or macrophages to infiltrate for the phagocytic action. There will be chromatolysis. There will be nucleus pushed toward periphery. Clear? These all are changes we will see after injury. ठीक है? Then occurs the regeneration start, and this regeneration starts after 90 hours of injury. ठीक है? And regeneration speed कितनी होती है? 1 to 3 mm regenerate per day. ठीक है? So whenever any nerve is undergoing regeneration, there is positive tinnial sign. What is positive tinnial sign? On tapping the injured nerve, if there is tingling sensation, this is indicating the regeneration occurring in our neuron, and this sign is known as tinnial sign. So any neuron undergoing regeneration will show positive tinnial sign. Clear? And regeneration कितने hours के बाद start होती है? After 94 hours. And regeneration speed कितनी होती है? 1 to 3 mm per day. चलो, this is the diagram showing degeneration and regeneration. Degeneration में क्या होगा? Valerian degeneration होगा. Further क्या होगा? हमारा phagocytic cell का infiltration होगा. Macrophages will be infiltrated, and after that what will happen? There will be proliferation of Schwann cell, and this Schwann cell will cause our regeneration. ठीक है? Regeneration होगा, re-innervation होगा. And this degeneration and regeneration is known as motor march. Progressive degeneration and re-innervation of muscle is known as motor march. Do remember this point. ठीक है? Clear, everyone? चलो. Now coming to the nerve injury prognosis. सबसे अच्छी prognosis होती है radial nerve injury की, and सबसे worst prognosis होती है common peroneal nerve injury की. Remember this point? अब आते हैं nerve injury की classification पे. That first classification is Seddon classification. इसमें nerve injury को 3 grades में divide किया गया है. Grade 1, which is also known as neuropraxia. And this neuropraxia is due to the nerve compression injury. ठीक है? इसमें axon जो है that is remain intact, while only myelin sheath injured होती है local areas में. ठीक है? काफी important है. Axon is intact in neuropraxia, and this neuropraxia is our compression injury. और सबसे अच्छी प्रोग्नोसिस न्यूरोप्रैक्सिया की होती है. रिकवरी अगर्स विद इन 6 to 8 week. Clear? Grade 1 injury, neuropraxia. This is nerve compression injury. Axon is intact while local myelin injury is there. And it has best prognosis. Recovery occurs within 6 to 8 week. Clear? Next grade of injury is grade 2, which is also known as axontomesis. This is nerve crush injury. Grade 1 was nerve compression injury, and this is nerve crush injury. In this, myelin sheath and axon both are interrupted. Clear? And इसमें जो recovery होती है that takes week to month. ठीक है? Next injury is grade 3 injury. This is also known as neurotomesis, and in this there is complete nerve transaction. And इस case में कभी भी perfect recovery और complete recovery cannot occur. Clear everyone? Neuropraxia, axontomesis, neurotomesis. Clear है? Everyone, जल्दी जल्दी reply करो. डिफरेंस समझ में आया सभी में? Shall we proceed? चलो. This is neuropraxia, which is the nerve compression injury. इसमें local myelin sheath damage होती है. Next is axontomesis. इसमें axon layer, axon and myelin sheath both are interrupted. ठीक है? Next is neurotomesis, which is complete transaction of nerve. Clear? अच्छा. Now coming to the next classification of nerve injury, that is Sunderland classification. ठीक है? इसमें first degree, second degree, third degree, fourth degree and fifth degree of nerve injury. ठीक है? First degree is nothing, it is our neuropraxia. Second degree is our axontomesis. Third degree is axontomesis plus endoneurium disruption. Good evening, Dr. Vishal. Good evening, Raj Pawan. Next is axontomesis. Fourth degree is our axontomesis plus endoneurium and perineurium disruption. ठीक है? Fifth degree is our neurotomesis. Clear? Sunderland classification में क्या है? First degree is neuropraxia. Second degree is axontomesis. Third degree is axontomesis plus endoneurium disruption. Fourth degree is axontomesis plus endoneurium and perineurium disruption. And fifth degree is neurotomesis. ठीक है? चलो. Now coming to the neurotrophins. What are neurotrophins? They are the responsible for the growth and survival of neuron, and they are also known as nerve growth factor. And from where our neurotrophins are released? Neurotrophins are produced from the astrocytes, and neuron take up this neurotrophin or nerve growth factor via endocytosis. Clear? What is neurotrophin? They are the factor responsible for the growth and survival of neuron. They are also known as nerve growth factor. They are produced by astrocytes and they are taken by the neuron via endocytosis. Clear? चलो, अब बात करते हैं different type of neurotrophins की. First is nerve growth factor, which is also known as NGF. Next is brain derived neurotrophin factor, which is also known as BDNF. Next is neurotrophin 3, next is neurotrophin 4 or neurotrophin 5. They both are same, neurotrophin 4 and neurotrophin 5. Beside this, there are some others neurotrophin also present in our body. First is ciliary neurotrophic factors. Next is glial cell line derived neurotrophic factor. ठीक है? Remember this point, various type of neurotrophins. चलो, first coming to the nerve growth factor. This nerve growth factor is responsible for the growth of sympathetic neuron, and they are responsible for the growth of cholinergic neuron and basal forebrain. ठीक है, याद रखिएगा सभी लोग ये पॉइंट. नर्व ग्रोथ फैक्टर इज रिस्पॉन्सिबल फॉर द ग्रोथ ऑफ sympathetic neuron and cholinergic neuron in basal forebrain. काफी बार रिपीट हुआ ये क्वेश्चन. नेक्स्ट इज ब्रेन ड्राइव्ड न्यूरोट्रॉफिक फैक्टर. They are responsible for the growth of vestibular ganglia and they are responsible for the growth of peripheral sympathetic neurons. ठीक है, next neurotrophin 3. They are responsible for proprioception neurons. ठीक है, and they are also responsible for mechanoreceptors in skin. Next is neurotrophin 4 or neurotrophin 5. They are responsible for the growth of neuron innervating our hair follicles. Clear? Everyone remember these growth factor. बहुत important है, काफी बार ऐसे repeat हुआ है question. Nerve growth factor are responsible for growth of sympathetic neuron and cholinergic neuron in basal forebrain. Clear everyone? Shall we proceed? Chal. Now coming to the first question. First question is, non-myelinated axon differ from the myelinated one. Option A are more excitable. Option B lack node of Ranvier. Option C are capable of regeneration. Option D are not associated with Schwann cell. Question sabhi ne padh liya? Now everyone answer this question. Non-myelinated axon differ from myelinated one. Everyone answer this question. Very good, Dr. Raj Pawan. Answer is B, lack node of Ranvier. ठीक है. Next question. Synaptic potential can be recorded via option A, patch clamp technique. Option B, voltage clamp technique. Option C, microelectrode. Option D, EEG. Everyone answer this question. Synaptic potential can be recorded by Everyone answer this question. Synaptic potential can be recorded by microelectrode. One electrode is placed at the presynaptic membrane. Another electrode is placed at the postsynaptic membrane. ठीक है? And from that synaptic potential is measured. So answer is C, microelectrode. Now coming to the next question. Magnitude of action potential is determined by option A, sodium. Option B, magnesium. Option C, potassium. Option D, calcium. Everyone answer this question. Magnitude of action potential is determined by Very good, Dr. Raj Pawan. Answer is A. Sodium influx जितना ज़्यादा होगा उतना ज़्यादा magnitude of action potential होगा. Very good, Dr. Deepthi. Next question. Action potential is initiated at the axon hillock and initial segment of the neuron because option A, threshold for excitation is low. Option B, neurotransmitter is released at this site. Option C, it is unmyelinated segment. Option D has lowest concentration of voltage gated sodium channels. Everyone answer this question. Action potential is initiated at axon hillock initial segment of neuron because Everyone answer this question. देखो, एक्शन पोटेंशियल एक्सॉन हिलॉक एंड इनिशियल सेगमेंट में क्यों जनरेट होता है, क्यों इनिशिएट होता है? बिकॉज दिस सेगमेंट हैज हाईएस्ट कंसंट्रेशन ऑफ sodium voltage gated channel. That's why the threshold out here is lowest. Answer is A. Very good, Dr. Deepti. Dr. Raj Pawan, न्यूरोट्रांसमीटर रिलीज कहाँ से होता है? हमारा एक्सॉन टेलीडेंड्रिया से रिलीज होता है, ठीक है? वहां से पोस्ट सिनेप्टिक मेम्ब्रेन पे रीच करता है, प्री सिनेप्टिक मेम्ब्रेन से रिलीज होता है एंड इट रीचेस टू द पोस्ट सिनेप्टिक मेम्ब्रेन. एंड वी आर टॉकिंग अबाउट एक्सॉन हिलॉक एंड इनिशियल सेगमेंट. तो यहाँ पे क्या होता है? हाई कंसंट्रेशन ऑफ वोल्टेज गेटेड सोडियम चैनल्स, दैट वाई थ्रेशोल्ड इज लोएस्ट, दैट्स वाई एक्शन पोटेंशियल जनरेट्स आउट हियर. काफी बार रिपीट हुआ है ये क्वेश्चन, तो रिमेंबर दिस पॉइंट, ठीक है? चलो नेक्स्ट क्वेश्चन. सिनेप्टिक कंडक्शन इज मोस्टली ऑर्थोड्रोमिक बिकॉज ऑप्शन ए, dendrite cannot be depolarized. Option B, once repolarized an area cannot be depolarized. Option C, strength of antidome impulse is less. Option D, chemical mediator is localized in presynaptic terminals. Everyone answer this question. Synaptic conduction is mostly orthodromic. What is orthodromic? Orthodromic is one-way conduction, or you can say conduction from our cyton to axon, and this occurs due to the neurotransmitter present in our presynaptic membrane. ठीक है? Answer is D. Very good, Dr. Raj Pawan. Next question. True about nerve impulse is option A, travel in one direction along axon. Option B, if current is increased, to slow nerve response. Option C, travel in one direction at synapse. Option D, travel with the speed of electricity. Everyone answer this question. Which statement is true? True about nerve impulse is impulse is orthodromic, that is travel in one direction at synapse. ठीक है? Answer is C. Clear everyone? Very good, Dr. Raj Pawan. Next question. Unidirectional flow of a nerve impulse is at synapse, axon, dendrites, all of the above. I guess clear है? Unidirectional flow of a nerve impulse is at very good everyone. Our unidirectional flow of nerve impulse is at synapse. Next question. True about Nissel's granules. Option A, involved in RNA synthesis. Option B, present in axon. Option C, present in dendrites. Option D, involved in protein synthesis. Option E, structurally they are endoplasmic reticulum. This question contains multiple answers, so everyone check out every options. True about Nissel's granule. Nissel's granule, they are present in dendrites. They are rough endoplasmic reticulum, so they are responsible for protein synthesis. C, D, and E. Clear? Chalo. Next question. Rapid axonal flow in the neuron is mediated by all except option A, dynein, excuse me, option B, kinesin, option C, neurofilament, option D, microtubules. Axonal transport is mediated by all except everyone answer this question. Dynein is responsible for the rapid axonal transport. Kinesin is also responsible. Microtubules are also responsible. Answer is C, neurofilament. चलो डायग्राम में देखो, क्लियर हो जाएगा. This is our axonal transport. For anterograde transportation, this and this are responsible. That are kinesin heavy chain and kinesin light chain are responsible. ठीक है. And retrograde transportation के लिए हमारा dynein heavy chain and dynein intermediate and light chain are responsible. And these are microtubules. They are responsible for our axonal transport. So answer is C, neurofilament. Clear, Dr. Deepti? Anterograde transportation के लिए हमारा kinesin is responsible. Retrograde transportation के लिए dynein is responsible. Microtubule is responsible for both anterograde and retrograde transportation. Clear? Chalo. Next question. Axonal transport is anterograde. Option B, retrograde. Option C, anterograde and retrograde. Option D, none. Very good, everyone. I guess clear है. Axonal transport is both anterograde and retrograde. Chalo. Next question. The neuron may get irreversibly damaged if exposed to significant hypoxia for 8 minutes, 2 minutes, 30 seconds, 15 seconds. Everyone answer this question. The neuron may get irreversibly damaged if exposed to significant hypoxia for डेटाबेस क्वेश्चन है, याद रखना है, एम्स में आया हुआ क्वेश्चन है. The neuron may get irreversibly damaged if exposed to significant hypoxia for more than 5 minutes. ठीक है, so answer will be 8 minutes. Very good, Dr. Deepti. चलो, next question. Which of the statement is true regarding nerve conduction? Option A, all and none phenomena. Option B, conduction independent of amplitude. Option C, propagated action potential is generated in dendrites. Option D, faster in unmyelinated fiber. Everyone answer this question. What is true regarding nerve conduction? Our nerve conduction follow all and none phenomena. Answer is A. Clear? Sure. Next question. The increase in threshold of a receptor when a series of stimulation of subthreshold intensity are applied in succession is called as adaptation, accommodation, initiation, resistance. काफी बार रिपीट हुआ है क्वेश्चन, दोनों टर्मिनोलॉजी याद रखनी है आपको. The increase in threshold of a receptor when series of stimuli of subthreshold intensity are applied in succession. Increase in threshold by subthreshold intensity is known as accommodation. Adaptation कब होता है? When the threshold is increased due to repeated stimulus of suprathreshold intensity. ठीक है, आंसर इज बी. क्लियर एवरीवन? चलो, नेक्स्ट क्वेश्चन. Equal strength stimulus of which type is least likely to produce nerve stimulation? ठीक है, see this graph and answer everyone. सभी स्टिमुलस की स्ट्रेंथ इक्वल है, but which type of stimulus will least likely to produce nerve stimulation? एम्स में 2002 का क्वेश्चन है. Everyone answer this question. Equal strength stimuli of which type is least likely to produce nerve stimulation? देखो, see this graph. पहले A और C ग्राफ देखते हैं. तो इसमें जो स्टिमुलस है वो फास्ट राइजिंग है, ठीक है, एंड इन दोनों में स्लो राइजिंग है, एंड लीस्ट राइजिंग दिस वन. लीस्ट राइजिंग हमारा स्टिमुलस स्ट्रेंथ, एंड ड्यू टू दैट व्हाट हैपेंड. वेरी गुड डॉक्टर दीप्ति, आंसर इज बी. लीस्ट राइजिंग स्ट्रेंथ स्टिमुलस की वजह से अकोमोडेशन की चांसेस बहुत ज़्यादा होती है, एंड ड्यू टू दैट it is least likely to produce stimulation. Clear? Answer is B. Clear everybody? Chalo. Next question. Identify the ion based on the conductance of a neuron during action potential generation. ठीक है? Everyone answer this question. Identify the ion based on the conductance of neuron during action potential generation. Everyone answer this question. Answer is A, sodium and potassium. This point is A. No, this is not A. This is A. And this depolarization is due to sodium ion influx, and this repolarization it is due to potassium ion efflux. So answer is sodium and potassium. Clear? Chalo, next question. Absolute refractory period is due to option A, opening of calcium channel, option B, closure of potassium channel, option B, C, closure of active gate of sodium channel, option D, closure of inactive gate of sodium channel. Everyone answer this question. Absolute refractory period is due to absolute refractory period is due to? It is due to the closure of inactive gate of sodium channel. Do remember this point, the gate concept. ठीक है, absolute refractory period is due to closure of inactive gate of sodium channel. Or sodium channel consists of M gate and H gate. M gate is activation gate. H gate is deactivation gate, inactivation gate. And this inactive gate is closed during the absolute refractory period. ठीक है, everyone remember this? Chalo. Next question. Initiation of impulse starts in option A, axon, option B, axon hillock and initial segment, option C, cell body, option D, dendritic tree. Initiation of impulse starts in Everyone answer this question. The initiation of impulse starts in. Very good, Dr. Anurag. Answer is B. Axon hillock and initial segment has lowest threshold, so the initiation of impulse occurs out here. Very good, Dr. Deepthi. Next question. Myelination in peripheral nervous system is done by option A, astrocyte, option B, oligodendrocytes, option C, ependymal cells, option D, Schwann cells. Everyone answer this question. Myelination in PNS is done by Very good, everyone. PNS myelination is done by Schwann cells. CNS myelination is done by our oligodendrocytes. Next question. True about Schwann cell. Option A, present in central nervous system. Option B, present only in myelinated nerve fiber. Option C, form myelin sheath. Option D, derived from surface ectoderm. Everyone answer this question. True statement regarding Schwann cell. No, Dr. Anurag. हमारा जो Schwann cell है, that is also present in our non-myelinated nerve fiber. Whenever they are present, that doesn't mean that it will undergo myelination. ठीक है? Schwann cell form myelin sheath. Answer is C. Very good, Dr. Deepthi. Next question. Nerve fiber involved in proprioception. Option A, type A fiber, type B fiber, type C fiber, type 4 fiber, option E, J fibers. Everyone answer this question. Nerve fiber involved in proprioception is. वेरी गुड डॉक्टर दीदी. प्रोप्रियोसेप्शन के लिए रिस्पॉन्सिबल होता है हमारा ए अल्फा फाइबर्स. सो आंसर इज ए. नेक्स्ट क्वेश्चन. Efferent neuron for skeletal muscle is alpha motor neuron, gamma motor neuron, one A fiber or one alpha fiber, one beta fiber. ठीक है? Everyone answer this question. Efferent neuron for skeletal muscle is. Everyone answer this question. This is the diagram. From you can see that alpha motor neurons are the efferent neurons for skeletal muscles and gamma motor neurons are efferent neuron for muscle spindle. ठीक है, तो efferent neuron of skeletal muscle is alpha motor neuron. ठीक है, clear? Answer is A. Everyone clear? चलो, next question. Group B nerve fiber are situated in option A muscle spindle, option B fibers carrying pain sensation, option C preganglionic autonomic nerve fiber, option D postganglionic autonomic nerve fibers. Group B nerve fibers are situated in. Everyone answer this question. Group B nerve fibers are situated in, everyone. They are situated in preganglionic autonomic nerve fiber. Postganglionic autonomic nerve fiber are type C. Clear? Next. The correct order of susceptibility of different type of nerve fiber towards local anesthesia is. Everyone answer this question. The correct order of susceptibility of different type of nerve fiber towards local anesthesia is. Very good, Dr. Deepthi. Answer is B. A fiber is most susceptible to local anesthesia and C fiber are least susceptible to local anesthesia. Chalo, next question. Group A fiber most susceptible to pressure, hypoxia, local anesthesia and temperature. Group A nerve fiber are most susceptible to pressure, hypoxia, local anesthesia, temperature. They are most susceptible to the pressure. Answer is A. Very good, Dr. Vanshika. ठीक है, लोकल एनेस्थीसिया के लिए भी मोस्ट ससेप्टेबल है, बट व्हेन ऑप्शन आर बोथ आंसर इज आर ए प्रेशर. क्लियर? चलो, नेक्स्ट क्वेश्चन. Slowest conducting fiber is option A preganglionic autonomic nerve fiber, option B postganglionic sympathetic fibers, option C somatic motors, option D proprioception. Slowest conducting fiber is slowest conducting fiber is, everyone answer this question. सबसे कम कंडक्शन स्पीड किसकी होती है? टाइप सी फाइबर. They are present at postganglionic autonomic nervous system. Answer is B. Clear? Next question. The efferent neuron which are most susceptible to LA. Option A fibers, B fibers, C fiber, D fiber. The efferent fibers which are most sensitive to local anesthesia. I guess clear है? हमारा जो ए फाइबर है दैट आर मोस्ट सेंसिटिव फॉर द हाइपोक्सिया और यू कैन से एल ए. For a local anesthesia, A fiber is most susceptible and C fiber is least susceptible. So answer is A. Next question. Conduction in which type of nerve is blocked maximally by pressure? ठीक है, A C fiber, B A alpha fiber, option C A beta fiber, A gamma fiber. Everyone answer this question. The conduction in which type of nerve fiber is blocked maximally by pressure? प्रेशर इंजरी, प्रेशर के लिए सबसे ज़्यादा ससेप्टेबल कौन सा होगा? हमारा लार्ज माइलिनेटेड फाइबर्स आर मोस्ट ससेप्टेबल टू द प्रेशर. So largest myelinated fiber is our A alpha fiber. Very good, Dr. Deepti. Chalo, next question. Which group of nerve fiber is least susceptible to local anesthesia? I guess repeat it. Skip karte hain. Next question. A patient slept keeping his arm by side and now he developed tingling and numbness sensation over the arm. Which of the following fibers is affected most? Option A C fiber, option B A delta fiber, option C B fiber, option D sympathetic fiber. Last year का question है. Everyone answer this question. A patient slept keeping his arm by side. Now he developed tingling and numbness sensation over the arm. Which of the following fibers is affected? Everyone answer this question. This tingling and numbness sensation is due to A delta fibers. Answer is B. Clear? Very good, Dr. Deepti. Next question. Joint position and vibration sense is carried by A alpha, A beta, A gamma. Dr. Deepti, A delta fibers, they are responsible for force pain or fast pain or sharp pain. ठीक है? And this tingling is our pain sensation and they are carried by force pain, they are carried by A delta fibers. Clear? The C fiber carries second pain. Chalo. Next question. Joint position and vibration senses is carried by. Everyone answer this question. Joint position and vibration senses is carried by. It is carried by A alpha fibers. Very good, Dr. Vigneshwaram. Next question. A delta fibers are not involved in. Option A force pain, option B slow pain, option C fast pain, option D epirectic pains. Everyone answer this question. A delta fiber are not responsible for, are not involved in. A delta fiber are not involved for the slow pain. Slow pain is carried by anyone? It is carried by type C fiber. Very good, Dr. Deepthi. Answer is B. Epicritic pain is a type of fast pain. Okay. Next question. Which of the following fibers carry fast pain? Repeat है, skip करते हैं. A delta fiber carry fast pain. Next question. Nerve conduction is slowest in C fiber, A alpha fiber, A beta fiber, A delta fiber. Easy, I guess. Nerve conduction is slowest in. Very good, Dr. Vigneshwaram. Answer is C, fibers. Next. Fastest conduction is for cold, pain, proprioception and pressure. Fastest conduction is for everyone answer this question. Fastest conduction A alpha fibers की होती है and A alpha fibers is carrying the proprioception senses. So answer is C. Very good, Dr. Vigneshwaram. Next question. Nociception from the abdomen is transmitted by A gamma, A alpha, C fibers and B fiber. Everyone answer this question. Nociception from abdomen is transmitted by pain sensation from abdomen is transmitted by our visceral pain or slow pain. So they will be transmitted by C fibers. Very good, Dr. Deepthi. Answer is C. Next question. Sensory fiber least susceptible to hypoxia. Type 1, type 2, type 3, type 4. Everyone answer this question. Sensory fibers least susceptible to hypoxia. Lloyd-Hunt classification याद है? Least susceptible to hypoxia. Our B fiber is most susceptible, then comes A fiber, then comes C fiber. This C fiber is our type 4 fiber. Yes, Dr. Vigneshwaram, our slow pain carrying fibers are least susceptible to hypoxia. So they are Lloyd-Hunt classification mean type 4 fibers are our C fibers. Remember? A alpha fiber, A beta fiber, A delta fibers and C fiber. The C fiber is least susceptible to hypoxia. Clear? Chalo. Next question. The fiber which is thickest in human nerve is option A touch, option B pain, option C temperature, option D proprioception. I guess clear है? काफी बार repeat हो गया. The fiber which is thickest in human nerve is thickest fiber are A alpha fiber. They are carrying proprioception. Answer is D. Very good, Dr. Vigneshwara. Which of the following five about sensory fiber is not true? A alpha is gamma. A beta is type 2 is A beta. Type 3 is A gamma. Type 4 is C fibers. Which of the following about sensory fiber is not true? Our Lloyd Hunt classification, they were only for the sensory fibers. Type 1 is A alpha, type 2 is A beta, type 3 is A gamma, type 4 is C fiber. Very good, Dr. Vigneshwaran. Type 3 is A, anyone? A delta fibers. ठीक है, answer is C. चलो, next question. Axontomesis include discontinuity in option A perineurium, option B epineurium, option C endoneurium, option D axon, option E myelin sheath. Neurotomesis, axontomesis, neuropraxia, याद है? Axontomesis include discontinuity in. डॉक्टर विघ्नेश्वरम, मेरे बारे में जानना है तो अनअकैडमी ऐप पे जाके मेरी प्रोफाइल देखिए, पता चल जाएगा आपको. Axontomesis include discontinuity in both our axon and myelin sheath. याद है? Neuropraxia. In neuropraxia there is discontinuity in myelin sheath. In our axontomesis there is discontinuity in both axon and myelin sheath. So answer is both D and E. Clear? Further जो classification था 1 degree, 2 degree, 3 degree, 4 degree, 5 degree. इसमें include किया था second degree was axontomesis, third degree was axontomesis plus perineurium damage, fourth degree was axontomesis plus epineurium and endoneurium damage. ठीक है? And fifth degree was neurotomesis. But axontomesis में there is discontinuity in only axon and myelin sheath. So answer is D and E. Clear? चलो. Next question. Best prognosis in nerve injury. This is nerve injury. Option A neuropraxia, option B axontomesis, option C neurotomesis, option D complete transaction. Best prognosis किसकी होती है? Everyone. Best prognosis in nerve injury is for everyone. Very good, Dr. Diti. Answer is A neuropraxia. This is the nerve compression injury. And in this injury, there is only disruption of myelin sheath. So the recovery is fast in this. So the prognosis of this injury is best. Clear? Chalo, next question. All are true about neurotrophin except option A help integrity of postsynaptic neuron, option B TRKB is associated with brain derived neurotrophic factor, option C help in growth of cholinergic neuron in basal forebrain, option D always transported antegrade along the axon. काफी अच्छा क्वेश्चन है. रिसेंट टाइम में न्यूरोट्रॉफिन से काफी बार क्वेश्चन आए हैं, तो रिवाइज कीजिएगा सभी लोग. True regarding neurotrophin except. First option is correct. It helps in integrity of postsynaptic neuron. Second option is also correct. TRKB is associated with brain derived neurotrophic factor. और हमने जो पढ़ा था, it help in cholinergic neuron and basal forebrain. This is also true. Answer D, because it is transported both anterograde and retrograde. Answer is D. Clear? Next question. Receptor for brain derived neurotrophic factors is TKA, TRKB, TRKC. Everyone answer this question. Clear है Dr. Deepti? Last question. प्रीवियस क्वेश्चन में पढ़ा था ये ऑप्शन हमने, याद है सभी को? रिसेप्टर फॉर ब्रेन डिराइव्ड न्यूरोट्रॉफिक फैक्टर. आंसर इज बी. क्लियर? चलो, दिस इज आवर न्यूरोट्रॉफिक फैक्टर्स. नर्व ग्रोथ फैक्टर और न्यूरोट्रॉफिन 6, 7, न्यूरोट्रॉफिन 3, they all act via TRKA receptors. This is tropomyosin related kinase receptor, A receptors. Brain derived neurotrophic factor or neurotrophin 4, 5, neurotrophin 3, they act via the TRKB. Neurotrophin factor 3 also act via the TRKC. ठीक है? And rest other neurotrophins act via the P75. ठीक है, काफ़ी बार न्यूरोट्रॉफिन से क्वेश्चन आ गया है लास्ट 2-3 ईयर्स में. सो डू यू रिमेंबर एवरी पॉइंट जो कि आज हमने सेशन में कवर किया है? एवरी टाइप ऑफ न्यूरोट्रॉफिन, देयर एक्शन, देयर रिसेप्टर्स. ठीक है, रिवाइज कीजिएगा सभी लोग. चलो, नेक्स्ट क्वेश्चन. नर्व ग्रोथ फैक्टर इज रिक्वायर्ड फॉर द ग्रोथ ऑफ ऑप्शन ए सिंपैथेटिक न्यूरॉन, ऑप्शन बी ब्रेन, ऑप्शन सी मोटर न्यूरॉन, ऑप्शन डी गामा न्यूरॉन्स. Nerve growth factor, our NGF, is required for the growth of everyone answer this question. These are required for the growth of sympathetic neuron. Answer is A. Clear? ठीक है, रिवाइज कीजिएगा. Very good, Dr. Deepti. Thank you so much everyone for joining. Hope you like the session. If you like the session, do like and share with your friends so that many more can join and class will be more interactive in that case. Do follow me on Telegram. जो लोग आज first time join किए हैं, do follow me on Telegram. My page is NEET Physiology, or you can search Unacademy Physiology, so that you will get notification of every class and you won't miss a single class. Do subscribe our channel, that is Let's Crack NEET PG, and press the bell icon so that you will get notification of every class and you won't miss a single class. If you take the subscription, do use my referral code, that is Dr. Nidhi, to get instant 10% discount in your subscription. Learning from home can be difficult, but you can definitely achieve it. कोई भी शॉर्टकट नहीं है. आपको पूरा सिलेबस कवर करना है, स्मार्ट तरीके से वर्क करना है, सिलेबस कवर करना है, एमसीक्यू ज़्यादा से ज़्यादा करना है. देन ओनली यू विल बी एबल टू अप्लाई योर थ्योरेटिकल नॉलेज इन एमसीक्यू. So I will highly suggest everyone do more and more MCQ after going through your topic. We will definitely able to achieve our target. We will definitely crack our exam with good rank. So lastly, मेरा रेफरल कोड रिमेंबर कीजिएगा. अगर आप सब्सक्रिप्शन लेते हैं, do use my referral code, that is Dr. Nidhi, to get instant 10% discount in your subscription. Thank you so much everyone for joining.